Hello, I'm Kristen Kosensky, and I am a coach and consultant working with many solopreneurs and entrepreneurs, small businesses. And I have a handful of clients that are preschools, Montessori schools, Reggio Emilia schools. So I have had some great experience working with school communities and school directors. I also am a parent of a now 12-year-old, so I understand school a bit and had my child in a Reggio Emilia school from the time that he was 6 months until he was 6 years old. So I don't know Montessori exactly because that wasn't my experience, but I know that Reggio is something similar to Montessori. I know for the purists, they might not like to hear that, but it's a more progressive, alternative type of preschooling. And so I can come at this conversation from that perspective. And our expert, our real expert today is Karen Duca. Karen is a PhD scientist. She's an expert in coronavirus and virology. She and I have been hosting an ongoing webinar series since coronavirus first hit the US in March, where Karen shares with us what's happening in the world of coronavirus from a week-to-week basis. She spends a lot of time reading the white papers, reading the science, and she brings it to us in a way that we can, as lay people, understand it. So with that, Karen is not a medical doctor. She is a scientist, and she will come to this from a scientific perspective. And so hopefully we will enlighten parents today, Montessori parents, on how they can approach life with young children while the pandemic is in the midst. So Karen, take it away.
Okay, great. So we actually did a little webinar for Montessori administrators and teachers, and we thought we'd follow on with a short video for parents. You know, many of you are concerned, I'm sure. As you look around, it is now the 12th of July, and like all of us, we're looking around, we're seeing cases on the rise, we're seeing the virus out of control in many localities. But on the other hand, there is a push to reopen schools. And, you know, in some places, it's safer than in other places. I want to make one kind of blanket statement is that every school is looking individually at what the case rate is in its locality, and decisions will be made. There are some places where there's just too many coronavirus cases to safely reopen any school. And if you're in that situation, your school probably won't open. But if you're in a safe enough place and your school has determined that it can minimize risk in reopening and has decided to reopen, we just wanted to give some advice to parents to keep the whole school community safe and how to think about whether you want to send your child back to school. So first of all, the main question is that you should be asking yourself, is your child at high risk? Does your child have any of the problems that are known to be associated with bad outcomes in COVID-19? We know that's fairly rare for kids, but if your kid is in that category, you probably want to keep them at home until the cases are much, much lower overall. Secondly, what is your family constellation like? We know that children probably do not spread the virus anywhere near as much as adults. We know they don't contract the virus anywhere near as much as adults. But that doesn't mean zero, right? It doesn't mean kids don't get it at all. Do you have a highly at-risk person in your home? A grandparent who's elderly, a parent who is perhaps overweight or diabetic? You have to determine for yourself if there's an at-risk person that should probably be protected. If that's the case, you might want to also think twice about sending your child to school. Now, if none of that's true, if everybody's healthy and probably not at high risk within your family, here's the second thing. Never send a sick child to school. You want to be checking temperature. You want to see how your kid is feeling. It may not be COVID, but you just don't want to send any child that's sick to school. And it will help the schools if you ascertain that before you get to the school and you're in the temperature check line and your kid starts telling you that they don't feel well. So that's also a smart thing to do.
That's interesting, Karen, is the idea of having a family ritual each morning about like whatever, like having a checklist or some sort of check-in that the family has each day. It's a great idea.
Yeah, and everybody can check in, it can make it a fun activity. Like, how do you feel? Have you been coughing? Have you been sneezing? Temperature, can take temperature, although that isn't always a completely good indicator. But if your child has a fever, you definitely don't want that child going to school. But assuming everything's fine, your child is healthy, look around at your own behavior. Now, if you want to send your child to school, the more common route of transmission is from adult to child rather than the reverse. So are you social distancing? Are you masking in public? Are you avoiding crowds and confined spaces where people are sharing the same air? There are basically 4 things we now know are the most critical for transmitting the virus. Enclosed spaces with poor ventilation, with a lot of people who are close together, extended time in these places, and coughing, sneezing, yelling, essentially sharing your exhalation with others. So if the question is, are you teleworking from home? Are you going to a job? So look at your own behavior and make sure that you're following the most rigorous standards that you can if you want to send your child out, because every time you go out, you're bringing stuff back. And if you've been able to be safe, or you're sheltering in place somewhat, if you're in a high caseload zone, that will make it safer for your child to go back into school. So these are some general principles that you should kind of keep in mind as you think about sending your children to school. And another question to
Karen, can I
ask.
ask you a question really quick about that?
Sure.
What are some questions that parents might be wanting to ask the schools?
Okay.
So they can look at their own behavior, but what do they want? What kind of expectations should they have or ask for, kind of thing?
Okay. First of all, number 1 question is, how many children are there together? How many kids are in the classroom? And are they staying together as a cohort? You don't want to be blending a lot of different kids of a lot of different ages. How old, how big is the school altogether? What's the age range? The younger the children, probably the less likely they are to vector the virus around. Do they have their own entrances? Where do they mix with other kids? So generally speaking, ask how many kids are going to be together, and will they blend a lot with other classes? Number 2, how good is the ventilation in the school? Is it a stuffy classroom? Will the kids be able to spend some time outdoors, which is a much safer scenario? Do they have individual entrances into their classrooms, or do they all go through a common lobby? They should be masking at any age. We are just not at a low enough number of cases in the country where masking should be optional. All the children should be masking. The teachers should be masking. Now, Montessori is a particular type of education where students, they're very independent, as I understand the methodology. They kind of do things on their own. They have their own
And they work
space.
in stations, different areas of the classroom. Yes.
Yeah, that's a good thing. And the fewer, like, is it one child per station? Is it two children per station? So again, the less blending of kids there is, the better.
So maybe asking about how the classroom will be handled,
Mm-hmm.
particularly now. And I don't know if they have workstations where kids sometimes work together or not, but that's certainly something that can be asked. 'Cause I know
Right.
that often there's individual workstations.
And how big is the room? I mean, if everybody's cramped together, that's bad. So I don't know how many stations there are in the average classroom, but again, it depends. Generally, we want to keep the number of kids low. 10 to 12 would be ideal if that's possible, maybe as high as 15. Higher than that, it's probably too many for today's situation, unless it's a huge room with, lots of different stations.
Would you have a square footage per child or per person room
Again,
idea?
the idea is still, are the stations 6 feet apart? 6 to 10 feet apart, I think, is what most schools are using. And what some schools are doing, and I don't know if this will even make sense, but they're putting like plexiglass onto desks to kind of contain aerosols. Can you plexiglass in? Is there a way to kind of put some protection around the stations? And as the child moves from one to another, are you cleaning it off? We don't think that surfaces and those kinds of things are as big a problem as we initially thought. It's really aerosol. So you want good ventilation, possibly HEPA filtering in the room. Many places are putting one of these air filters that turn over the room's air, gently turning it over a couple of times an hour. I think up to 5 is probably good, that it doesn't start blowing aerosols around if there should be any. Yeah, those are the kind of things I would look at. Also be aware there's some concern. Are people looking at bathrooms? Because we know the virus can be shed in feces, and flushing toilets can actually be a little bit problematic. It's like coughing, if there's live virus in the feces, flushing a toilet can be like coughing it into the room. So you want to tell kids to, put the lid down on the toilet before flushing it. We don't know how active, how infectious the virus is that is shed, but it has been found in wastewater throughout the country. So that's something also to maybe ask a question about. But the most important things, how spread out are people? They can't be crowded. They have to sort of keep their distance, and they don't want to spend a lot of time in enclosed spaces breathing each other's air. Get them out every couple of hours. I think that's probably done anyhow, at least until it gets too cold. So just looking at the same logical things that we're all doing, the same things really apply in schools. I know it's harder for the young ones maybe to keep masks on and, not hugging and kissing their friends. I think with the Montessori principles, I'm sure they can be taught to social distance to some extent.
Yeah. And also, Karen, just to reiterate, I think this piece where families begin rituals around their own personal health and checking in on that. And then also, as parents, taking advocating for yourselves and your families in terms of the schools, really, especially in the Montessori schools, because it's so much about community, and that the school is really just an extension of the community, that parents really advocate for all families to get on some sort of same page together. That
Yes.
since it is, community is so important in the Montessori system, really based in that, is that really to work and as parents, be a part of that conversation. Because I
Absolutely.
know that having worked with Montessori administrators, they want parents to be part of that conversation too. And the more
Okay.
people that have buy-in to whatever that is, what as a community the agreements are, the healthier people are going to be.
hmm And you might even have the schools draw up a little checklist,
Hmm.
just trying to find out, are you doing this? Now, one thing I was about to say, is there an older child in the family who's going to a public school?
Mm.
And these are the kinds of things you really have to look at. Like, how are the family members behaving? And is everybody kind of at the same level of how much outside contact they have with people? Is everybody doing their best at maintaining the most rigorous masking and social distancing? Because where you're going to have trouble is if 95% are and 5% aren't. That's where you're going to have your problems arise. And what you should ask the school is, what are your triggers? Every school is going to establish a trigger point for, if we see an infection in an individual class, we are going to have to shut that class down for 2 weeks. That's an average. That's usually what people are doing. If a child or a teacher, one infection per class is usually the trigger that class has to quarantine at home. The rest of the classes, if they're okay, they can keep going. And a common trigger point right now is 5 classes will shut down a school. And the time it takes to reach...
Five cases.
Sorry,
not
5
classes.
cases. Sorry,
Yes.
confusing cases and classes.
That's okay.
5 cases will shut down a school. Now, obviously, you're going to reach those 5 cases a lot faster in a larger school than a smaller school. And you'll reach those 5 cases faster if not everyone is making an effort at home. Because, again, the home is probably the most common place of transmission. So children are getting it from adults and older siblings. We don't have a lot of data because we shut down schools pretty quickly based on assumptions from the past that might not map quite as much to COVID as they did to flu and other viruses. We're still learning about how transmission within classrooms and schools is going to happen. As schools open, we'll quickly collect data. We'll quickly see how effective the measures that are particularly in public schools, because that's where there's very high numbers and very, very close contact between students. That will really help us understand this better.
And interestingly, I think that it's a real upshot to educating yourself in a Montessori setting is that typically they're smaller settings, which is good.
Mm-hmm.
And also because of the community-based philosophy, then you can have agreements that you may not be able to have in public schools.
Very true.
Any final thoughts, Karen?
Those are the main things I would say. I think a lot of the burden is really on the schools to look at the community and the cases in the community and determine whether they think it's safe to reopen, under what conditions, what are their trigger points for closing the classroom. I think it would be good, for both sides, the school and the parents, kind of have a checklist of procedures, of things everyone agrees to do to try to keep the kids coming into school as safe as possible and minimize the chance of, moving the virus from community to school setting.
Awesome. Well, thank you, Karen.
You're very welcome.
If any parents have questions, feel free to ask. I think Nido will probably be passing this out. They're Montessori schools and they can get questions back to us and we would be happy to answer them.
Yeah, we're happy to do a follow-up. We want to know, what is it that you mostly need to know? and to help you make your decisions, to help keep your kids safe, once they go back into school. Happy to help.
Have a wonderful day. Stay healthy.